My name is Kerrie. I'm a psychotherapist by background and I'm the CEO and founder here at Orri. I've been working with people with eating disorders for over 20 years now, and 6 years ago was in a very privileged position to be able to set up Orri. Orri is a daycare and outpatients treatment centre based in London and online, and we've worked with over 1,400 people in the last 6 years. We have an amazing team of professionals who I feel very proud to work alongside. There's about 120 of us now. Around 60, 70 of those are clinicians, and they work across all different modalities and different types of practice. So we have psychiatrists, nurses, doctors, we have dietitians, occupational therapists, and psychotherapists and psychologists. And our therapies team are made up of all different types of therapeutic approaches. So more talk-based therapies, creative, movement, art-based therapists. We have somatic therapies, yoga, mindfulness, breathwork, sound baths, anything that we need to really help somebody kind of engage and connect with their recovery. An eating disorder is really a response to something in your life where you feel that you need something to protect you, something to keep you safe. And what we often say at Orri is that whilst an eating disorder looks like it's all about food, it's not really about food at all. It's a way of making sense of the world, a way of finding retreat or safety when the world feels really difficult or really dangerous or really uncertain or really unsafe. There are a number of ways that an eating disorder can impact somebody, physically, psychologically, socially, to name a few. I think the fundamental thing that happens is they really change the basics of how somebody can live. They get into the real everydayness of life, the simple things that somebody in recovery or without an eating disorder will just take for granted become really difficult. If you've got an eating disorder and you're becoming more socially restrictive, meeting a friend, going out for a walk, grabbing a coffee, the sort of normal things that you might just do without thinking become really, really difficult, really overwhelming. If you have a lot of shame about your body, if you feel uncomfortable in the body you inhabit, things like, oh, the sun's out today, that's nice, I'll slip a t-shirt on, suddenly feels like a really terrifying thing to do. So I might then withdraw myself and not want to go out and be engaged in those sorts of settings. So we think about eating disorders, we think about food, we think about all these negative stereotypes and myths that surround them. But really for me, the big impact of an eating disorder is how it changes someone's everyday life. I think being around somebody who's got an eating disorder is really, really difficult. Whether you are the partner of somebody, the child of somebody, whether you work alongside somebody, whether it's a good friend, it's really frightening to see somebody developing an eating disorder because they will themselves feel like they are changing and the person around them will feel like they're changing. They can feel kind of absent and difficult to connect with, like you can't quite find a way of communicating in the way that you used to perhaps. They'll seem distracted, disinterested. Sometimes they can become quite grumpy or irritable, frustrated with you, and it can feel really difficult to understand why. So I think those changes in a relationship can really set off a chain reaction, if you like, and make that coming back together even harder. When somebody is perhaps, let's say, losing weight, there's a lot of anxiety, there's a lot of fear, what's going to happen. We know more about eating disorders now, so I think people immediately react to try to stop that, quite rightly, I get it, but equally that can set off some really difficult dynamics. So I think what happens for people when they are watching someone with an eating disorder is fear. There are lots of common misconceptions around eating disorders, and I think the main one really is that eating disorders aren't really that big a deal, that somehow it's something that someone will grow out of, that it's a phase, that it's just about wanting a beach body, it's about wanting to look good, it's a very sort of aesthetic, externalized disorder that on some level people have made a choice to have. An eating disorder is an illness, it's a complex mental health illness. It has very, very serious consequences, physically, emotionally, psychologically. It changes someone's life so fundamentally. So these myths and these perceptions that somehow it's something that people choose to do mean that we don't take it seriously, we trivialize it. So when you find yourself starting to struggle with it, you too start to trivialize it and minimize it and think it's not really that big a deal. So So the way that we would recognise an eating disorder is through diagnosis, and that happens through assessment. So there are different markers that will indicate whether somebody has moved into the territory of having a clinically diagnosed eating disorder. So within anorexia, for example, that will be things looking at a BMI that is lower than 18. It will look at patterns of restriction. It will look at some sort of physiological symptoms, and it will consider things like amenorrhea, so when a woman, for example, stops menstruating, so she doesn't have her periods anymore. So it's kind of building up a collection, building up a pattern of things around that eating disorder. In bulimia, it will be looking at patterns around the purging. And then with ARFID, the assessment is really much more complex because we're breaking it down into lots of different components. So really thinking about the different types of ARFID that someone has, so there's not just one type of ARFID, and then doing assessments around those sorts of things, sensory profiles of foods, looking at sort of things that may have caused the person to become preoccupied, for example, with not eating, etc. So there are 5 main eating disorders: anorexia nervosa, bulimia nervosa, binge eating disorder, OSFED, other specified feeding or eating disorder, and ARFID, avoidant restrictive food intake disorder. Anorexia nervosa is a restrictive eating disorder where a person will become focused on their body, shape, weight, and reducing intake of food with the intent of losing weight. Bulimia nervosa is a condition where people will induce vomiting, or maybe use laxatives, or use excessive amounts of exercise to compensate for any food that they take on board. Binge eating disorder is a disorder which is classified by eating excessive amounts of food with the intention of managing difficult or overwhelming feelings. OSFED, other specified feeding or eating disorder, is essentially where in any of those categories somebody doesn't meet the full diagnostic criteria. So let's say, for example, that somebody is heavily restricting and it may look like an anorexia presentation, but perhaps their BMI doesn't meet the anorexia classification. Avoidant restrictive food intake disorder, commonly known as ARFID, is a condition where people will restrict or minimise the types of food they take in on the basis of the response or reaction that they have to that food. If you're worried about somebody that you know and you think that they might have an eating disorder, the best thing to do is get resources, is to reach out and speak to somebody, contact a service like Orri, and we can sort of help to direct you and think that through with you.